Hi, I'm Jordan Kenny and welcome to Coronavirus Catch-Up. We're live on the BBC News NI website and Facebook page and on the BBC iPlayer for the next 20 minutes or so. Thanks for tuning in, however you're joining us. Well, we're back after our Christmas break and we've hit the ground running. We've got virologist Professor Ultan Power with us to answer your questions shortly. But first, there's been a lot happening. The Prime Minister made a TV address last night to announce a new lockdown in England. Scotland and Wales have also tightened restrictions. Here, we're in week 2 of a 6-week lockdown, but with another 12,000 cases in the last 7 days, it seems more measures are on the way. Earlier today, transfer tests were called off. However, we've just heard in the last half hour that one test will be held in February. It looks like schools will now stay shut until after the February half term. There was an executive meeting at 4 o'clock, and here to bring us up to date is our political reporter, Jane McCormick. So I'm just here and we have a connection issue with...
It's okay, we're here.
So Jane is here. She's here on the line. Hopefully we'll see you in a second, Jane. It's the beauty of video conferencing and broadcasting like this.
Yeah.
But Jane, what's the latest? Are ministers still meeting?
So the reason I had some technical difficulties there, Jordan, was because I was getting communications from some of those involved in the discussions at Stormont, and what they are telling us is that the discussions on COVID have now wrapped, and the papers from the Health Minister and the Justice Minister and the Education Minister were basically agreed. So everything that they'd brought essentially has been signed off, if you like. There were no major rows around the table over it. So what we're being told is, obviously, that detail last night about schools moving to remote learning, that was confirmed, and we'll hopefully get details soon of how that's going to work and how that will affect all educational settings in Northern Ireland. We're also told that churches are going to be allowed to remain open at this time, so there was potential that maybe they would move to individual prayer only, or that they might close them down fully. That doesn't sound like that is going to happen. There was also the possibility of ministers bringing in a 10-mile travel limit. Now, I'm told that was something that Justice Minister Naomi Long had proposed, but that hasn't been taken on board by ministers at this time. But they are going to move to put the stay-at-home message back into legislation, which will mean that you'll only be allowed to leave your house for the most essential reasons, like to take exercise, to go and get groceries, if you have to go to work, for example. But bringing in a specific limit hasn't made it over the line this time. I'm also told that in terms of gatherings, when it comes to gardens, we're being told that it's going to move down. So currently you can have 6 people from 2 households in one garden. That's going to go down to just only allowing 1 household to be present in a garden. So effectively just the one family, and children will also count towards that total. And outdoor gatherings, which are currently limited to 15 people, I'm being told that is going to go down to 6 people, and children will also be counted among that. But in a change, I guess, to what we had recently, we've been told that under the restrictions you could only go for exercise with members of your own household. I'm being told that they will change that, and you'll be allowed to go for a walk with one other person outside of your household. So effectively you can go for a walk with one person from another household, or if that's your support bubble, so be it, that kind of thing. So I'm sorry, that's a lot of detail to bring to you, but this is what I'm hearing has just been agreed. Obviously we've yet to hear from either the First or Deputy First Ministers. I think that as the night goes on we will hear a lot more about all of this.
So lots just coming in there, Jane. We also heard earlier, just at about 6:30, about the transfer tests. What more can you tell us about them?
Yeah, this is a pretty big move, isn't it? Because just earlier today, we'd been told that the transfer tests wouldn't be going ahead later this month, and that they've been cancelled effectively because, of course, schools are going to be in that period of remote learning then. Now what my education colleague Robbie Meredith, our education correspondent, has revealed tonight is that AQE, the Association for Quality Education, which is one of the 2 companies that runs the tests, they have now decided that they will run a single test on the 27th of February. So those tests are used for the voluntary sector, and there are 34 grammar schools that use this method of selection. So what they're telling us tonight is that while they are aware of the pressure on parents and pupils and teachers around all of this, they have decided now tonight that they will reduce the number of tests they normally do, and I suppose in line with whatever public health guidance there is at the time, this is now their plan to let that test go ahead on the 27th of February. So I suppose it maybe adds to the confusion that there has been today with parents and pupils who thought maybe that it was clear that it wasn't going ahead. It now looks that their revision and their preparation for these tests maybe might not be over yet.
And just to add, if you are watching on Facebook, feel free to get involved in the comment section. If you have any questions about what's being talked about tonight at any stage, leave it there and we'll try and get to it before we finish. Jane, we've had lots of questions in today about shielding and advice for shielders. Obviously, at the beginning of the pandemic last year, letters were issued to about 80,000 people in Northern Ireland advising them to shield. Has there been any updates on that today?
No, there hasn't, and I don't think there is going to be. I suppose it is worth bearing in mind when we talk about all of this and some of the restrictions that are changing, Jordan. Northern Ireland did go into a lockdown back on Boxing Day. It feels like a long time ago now, but it wasn't that long ago. So we went into a 6-week lockdown on the 26th of December, and the advice at that time from the Chief Medical Officer was that if you were one of those clinically vulnerable people who received a shielding letter back in March, you should have then been thinking about whether or not it was safe for you to go back into the workplace. So it doesn't sound like formal shielding will be reintroduced, but the executive already says that if you did shield in the past, then you should consider really whether or not you should be in the workplace. And obviously it goes wider afield than that, because the executive is saying that with that stay-at-home message coming into regulation, really they'll be saying to people, you should only be going to work if you cannot work from home. And I think that's the sense that they'll be trying to get across to people. But we know that when it comes to the messaging around all of this, that is an even bigger task for ministers, is trying to get people to comply and also to understand what is at times quite complicated given how many times some of this has changed.
Jane, we could talk a lot more about this, but I appreciate this is all just breaking and you're up to your eyes. You have a lot to get on with, so we'll leave it at that. But thanks for chatting to us tonight. We really appreciate it. Now, also joining us tonight is virologist Professor Ultan Power. Alton, thanks for coming on. How are you? Alton, how are you doing? You're a professor of molecular virology at Queen's University in Belfast. Hopefully my connection seems to have frozen. We're doing well tonight with the video conferencing. It's going as smooth as ever. But hopefully we'll get Alton back shortly. But what we're going to be talking about is more of the lockdown. So as we've been discussing with Jane, we're in the middle of a 2-week lockdown and it looks like more restrictions are coming. It's something that's at the forefront of everyone's mind, and we've had lots of questions in about it that we'll hopefully be answering with Alton when he comes back, when he returns. But just to go over what we've heard on the transfer test, I think we've got Alton back.
Hi, how are you doing, Jordan?
Alton, how are you?
I didn't hear a word of what you said there because I seem to have lost the signal there.
No problem. Like I was saying to Jane, this is the beauty of broadcasting online during a pandemic. Who knows what's going to happen? But thanks for coming on tonight, Alton. You're a professor of molecular virology at Queen's University in Belfast. Firstly, can you explain to us what that means? What actually is your job?
So the main job that I do, Jordan, is to research viruses. In my case, it's respiratory viruses, and I've been dealing with respiratory viruses, primarily human respiratory viruses, since 1990. So for quite a few years now, I've been trying to figure out how they work, how they cause disease, why some people get really, really sick with these viruses and other people don't. The main virus that I've been working on up to last year with the pandemic was a virus called respiratory syncytial virus, which causes bronchiolitis and pneumonia in very young children and also causes a lot of disease and death in the elderly. So it's not unlike the SARS-CoV-2 virus and what's actually happening there. So the main things, as I say, we try to figure out is how the virus works, what are the genes that are important for causing the disease, how it interacts with the cells of the body, and what kind of inflammatory responses and things like that we actually look at. So this is in terms of RSV. In terms of SARS-CoV-2, or the causative agent for the COVID disease, for the last year, we've been researching how the virus interacts with human airway epithelial cells. And also a major component we have is trying to identify drugs that might be able to treat the disease, either by blocking the virus or by dampening down the inflammatory response that causes most of the disease that we're aware of associated with COVID-19. We're screening in the region of over 2,000 drugs. Most of these are FDA approved. So if we do find some hits, hopefully we'll be able to move into the clinic very, very quickly. And also combinations of these drugs, so that overall we're looking at perhaps over 500,000 different combinations of drugs to try and find some that might be able to treat the disease. So that's advancing well. We have some interesting hits that we're looking at in more detail at the moment, and hopefully in the next few months we'll be able to get some that will have be able to develop into the clinic.
Well, as we've been discussing with Gian Alton, we're obviously in week 2 of 6 weeks of lockdown here in Northern Ireland, and we've heard there from Gian just earlier about new restrictions or new rules that are coming in. So lockdown is obviously something that's at the forefront of everyone's minds, and we've had lots of questions about that. But the first question I wanted to ask you tonight is, how effective are lockdowns in the fight against COVID?
So as we've seen from the lockdown that happened between March and June, the lockdown was actually very, very successful, because we ended up then in June, July and August to have very, very low numbers of cases in the community. We were in the single digits at that time. So that clearly indicated, with a complete lockdown where everybody would stay at home, and it was really only healthcare workers and essential workers that were moving and going to work at the time, that the numbers were able to be reduced to a level that were, allowed the whole of society basically to open up. So if the lockdown is tight enough, then they're very successful. Probably what we've seen in the last few major mitigations or restrictions that we've had is that certain aspects of the restrictions were adhered to, and some were left open. For example, schools were left open throughout the period from September to December, with obviously the 2-week break, or the 1-week break at 2-week break actually at half term, and therefore, then we always had something where a lot of people are going to school. It involves a fairly sizable proportion of the population either bringing the kids to school, or the kids themselves moving to school. So this, to me, when I look back on the data, it suggests to me that maybe we have to consider the lockdown more for this particular period now, and ask whether or not we should include the schools in this case, as is being done, say, for example, in England, Wales and Scotland at the moment, because it's an extra element that we haven't perhaps considered before, the importance of schools will have in the transmission of the virus.
So in your opinion, we've had this question sent in for you, Alton. With the rollout of the vaccine, will this be the last lockdown Northern Ireland will face?
So difficult to say at this point. I'm certainly very optimistic, Jordan, in the sense that it will, in my estimation, will be a considerable game changer in the way the virus circulates. What we've seen so far, we have 3 vaccines that have shown the capacity to be able to eliminate, for all intents and purposes, eliminate severe disease and have a major impact on any COVID-19 cases. So that is very, very positive. If we end up with a situation where the disease can be controlled and the impact of the disease can be controlled by vaccination, then that will likely have a huge impact on the necessity to have lockdowns subsequently. One difficulty is that as we roll out the vaccines, we may see more and more of these variants, which we've heard about over the last few weeks, the B.1.1.1.7 virus that's been circulating, that's got a higher propensity to transmit. And as we roll out the vaccine, we increase the possibility that maybe some of these new variants might occur, which will diminish the efficacy of the vaccine, okay? We see that every single year with influenza, for example. There's a new influenza vaccine that needs to be rolled out every year because there's new strains circulating. So it's possible the same thing might happen with the SARS-CoV-2 virus, but that remains to be seen. So I think overall, to answer the question in a roundabout way, I think it will have a major impact on the necessity for lockdowns, but what needs to be done in the future, I guess, remains to be seen still.
Well, you've touched on something there, Alton, that I actually want to ask you about, moving on to questions about the vaccines. This question is in from Paul, and he's asking, is the COVID-19 vaccine likely to become an annual requirement similar to the flu vaccine, like you were saying? And if that is the case, would it be required by the whole population or just those who are more vulnerable?
So the short answer is we don't know for sure yet. And one of the things we don't know from the vaccine trials yet is how long the immunity will actually last for the vaccines that are there. And that's going to be an issue. So if, for example, the vaccine lasts for maybe 6 months, then it's likely we will need to get the vaccine re-administered next year, the year after, etc., as an annual event. So that's one possibility. The other possibility, as I say as well, is that you have virus variants that are not covered very well by the vaccine. And if that happens, then again, like influenza, we'd need to develop new vaccines that are capable of dealing with the current strain at a given time. So too early to say yet definitively, but it is something that we need to keep in mind for the future.
Well, Deborah and John have both been in touch about the new coronavirus variant that we've heard a lot about in the past week or two. This new strain is more contagious than before and in places is rapidly replacing other versions of the virus. Are the COVID vaccines that have been approved here, so the Pfizer, BioNTech and the Oxford AstraZeneca jabs, are they going to be effective in immunising people against this new strain?
So there's no evidence at the moment, Jordan, that the current vaccines will be adversely affected to a large degree against this new strain that's circulating. There is some evidence that one of the mutations that are happening within this, the spike protein will have an impact on one of the parts of the virus that is recognized by the immune system. But this is only one of several that's recognized in the vaccines. So at the moment, our understanding is that it will not have a major impact on the vaccine. But that possibility of accumulating more and more changes is possible. And we need to look at that as we go forward over the next months, several months and years, how the virus itself reacts to having to deal with a bunch of people that are vaccinated.
So in terms of the vaccine itself, is the vaccine, when you're vaccinated, is it protecting against catching the virus or is it reducing the effects of the symptoms if you happen to contract it?
So all the evidence so far is indicating that it stops severe disease and it also reduces the amount of cases substantially. So this is why we talk about the efficacy. So how well does it actually reduce the disease associated with the SARS-CoV-2 infection? And for many of these vaccines, the 3 vaccines, we're looking at efficacy over 90%, in some cases 95%, which is really, really exciting from a vaccine point of view. What we don't know yet, and there's still limited data on it, is whether or not that the vaccines actually prevent you getting infected and being able to transmit the virus to other people. So that's something that is ongoing. Those studies are ongoing. There's some suggestions from the data from the Moderna vaccine that it may actually have a small impact or some impact on the transmission. And similarly, some data from the Oxford vaccine, the AstraZeneca vaccine, that also may have a small impact on the ability of people to transmit the virus following vaccination. All of which, again, is good news, but too early to say yet definitively that is the case.
In relation to the dosage of the vaccine, Alton, both the UK approved vaccines require 2 doses, but a policy change announced by the government on the 30th of December means the time between the first and second dose of the vaccines has been increased from the initial 3 weeks to now up to 12 weeks. Full immunity starts 7 days after the second dose. So with that in mind, is this something that we should be concerned about?
So what's concerning, Jordan, is that the JCVI has changed and the MHRA have changed the criteria that we use for the Pfizer vaccine within the 3-week period. So that is a concern, right? But that also needs to be put in the context of the pragmatism that we're faced with right now. Every day, people, 400, 500, 600 people are dying every single day of this disease in the UK. So the pragmatic decision that was taken was that if you immunized twice as many people with a single dose, you're likely to have a much bigger impact on the number of people who die as a result of this infection. And this is their choice that they're made. And they're made that then also based on examining closely the clinical data from the phase 3 clinical trials to see what is happening between the first and second doses in terms of efficacy of the vaccines. So in terms of the Pfizer one, it's a complete change from the standard protocol that was used. In terms of the AstraZeneca Oxford vaccine, part of their trials actually included people that were vaccinated up to 12 weeks. So in this case, then, they will be similar to, the recommendations are similar to what part of the phase 3 clinical trials were for the Oxford AstraZeneca vaccine. The concern really is not so much, from my perspective, not so much from a vaccine efficacy point of view, in that, you know, if you delay the period from the first dose to the second dose to a 3-month period, 12 weeks is what we're talking about here, I don't expect that that will have a major change in the number of, or the efficacy of the vaccine, okay? Because if you think about the standard vaccines that are given to children now, they're, all of them pretty much are 2 months windows, or 2 months duration between the first dose and the second dose. So from an immunological point of view and inducing a really good immune response, I don't expect that to be a major problem. And in fact, there is some evidence from the Oxford AstraZeneca vaccine suggesting that in fact, the 12 weeks is actually better than the 4-week period. Where I am concerned is that for some people, the amount of immunity that is induced by a single dose of the vaccine might be suboptimal. And that may increase the possibility then of getting these mutant or variant vaccine viruses that are able to infect. They're not quite neutralized by the vaccine or the immunity that's been induced by the vaccine. And they may be able to escape then the vaccine, or may help the escape of these vaccines. That remains a theoretical possibility, but it's something as a virologist I would be very concerned about.
And just finally, Alton, what is your predictions for where Northern Ireland will be at the end of this 6-week lockdown in relation to coronavirus?
It's difficult to say. I think the big thing that needs to happen, Jordan, in my mind, is that first of all, people need to buy into this. We've had the restrictions on before Christmas and also in October, and you know, a lot of people are not necessarily taking it as seriously as it needs to be taken. This is my concern at the moment. So what I'd love to see now is that during this period, people really do take it seriously. Stay at home as much as you possibly can, and give our colleagues in the health services a bit of room to breathe, to be able to deal with the upsurge in the people who are getting sick and coming into the hospitals. That would be the first thing. If that happens and people buy into it, you know, with this spirit of everybody is in this together, I think that will have a big impact over a 6-week period on the numbers that are actually happening, the number of cases and the transmission of the virus throughout the community. I think, as I said earlier, it needs to be coupled with school closures for that period, and then obviously evaluate after 6 weeks to see where the R value is, the level of cases that are present in the community, and if necessary, extend it again for another couple of weeks, or as the case may be, to make sure that we get the numbers down to a very low level. If we get the numbers down to an extremely low level, it will greatly facilitate the capacity to be able to roll out the vaccines as quickly as possible, because we can't vaccinate people who are sick. And also, if a lot of people in the health system are also out sick, it means there's less people to administer the vaccines as well. So this, I think, it would be a really good opportunity to get the numbers down to a level where we can get the vaccines rolled out and make people as safe as possible in this period and for the few weeks and months after this actual lockdown as well.
Alton, thank you for that. We really appreciate you taking the time to come on tonight and answer those questions. We've had a few questions on Facebook while we've been on air about what's happening with GCSEs and A-levels this year. We heard from our political reporter Jane McCormick earlier about what's happening with transfer tests. As we've been on air, our education correspondent Robbie Meredith has said it's still not clear what will happen for GCSE, AS and A-level exams set for this year and if they'll go ahead as planned. There are English and Maths GCSE modules taking place next week, and at this stage we don't know if they'll be going ahead, but we'll keep you updated on the BBC News NI website. This has been a really interesting discussion. It's been a really interesting coronavirus catch-up filled with tech mishaps and lots of breaking news, so it's been exciting, but we're unfortunately out of time this evening. Thanks to Professor Ultan Power for coming on and answering those questions, also to our political reporter Jane McCormick as well. Thanks to everyone who got in touch with their questions. We didn't have enough time to get back to all of you, but hopefully the questions answered tonight will have covered some of what you were looking to know. Don't forget you can keep up to date with all the latest developments on the BBC News NI website, which you'll find at bbc.co.uk/newsni, or you can follow us on Facebook, Twitter and Instagram. Just search for BBC News NI and you should find us there. We'll be back again this time next week to put more of your questions to the experts, but until then, stay safe.